There are many reasons why young people, particularly teenagers, get involved with using drugs. One of them is just because they're teenagers. It's ironic that at this time of life, when their brain is undergoing a lot of risk-taking, developing, growing, experimenting, it's also a time when experimenting with drugs can do the most damage to a kid's brain. One of the things that research has shown is that transition times in students' lives are very difficult. Times from going from elementary school to junior high, from junior high to high school, from high school to college. These transition times are times when kids are more likely to be using or experimenting with drugs to deal with some of the stress of those transitions. Young people also may be tempted to use drugs as a way of self-medicating. Research has shown that students who are depressed, who are experiencing difficulties in school, may turn to drugs as a way to help them deal with some of the stress, some of the anxiety of those illnesses. Of course, we mentioned school. School is another issue. Students who are not successful at school, particularly from an early age, kids who are not invested in doing well in school, also seem to be kids who are more likely to experiment with drugs. One of the things that we also know is that peer pressure plays a role. When students have friends who are involved with drug use, they may feel an internal pressure. A question of what's it like, what is this going to feel like, how is this going to be? And if their friends are reassuring them that they're fine, that this is exciting, that brain development, which has not yet gotten to the point of evaluating consequences, may encourage them to try this out. So there are many reasons why kids use drugs.